Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about menopause and its effect on oral health. Let's start. So today's episode is all about menopause, and this is directed as a social responsibility and message towards all the women who are perimenopausal or who have doubts about menopause or already have undergone the process and phenomenon of menopause. And this is after a thorough research that whatever changes that are seen in the oral health and the oral mucosa, I have come up with this episode where I'm going to be talking about what all changes happen once you undergo this phenomenon of menopause, and how it affects your body, how it affects your mood, and what all you can do to make sure that your oral health is safeguarded. So a menopause is actually defined as a period of amenorrhea. That means you don't have your menstruation for at least 12 months straight after around 45 years of age, and this is considered as a very a very eventful time because of the fact that your body undergoes a lot of changes in terms of the circulating estrogen and progesterone, that is the sex hormones, and a lot of things about your calcium levels and your bone metabolism and all those things. So let me talk about in general about what all symptoms you can go through in terms of your oral health when it comes to menopause. The first and the following symptoms that you can see is like xerostomia. That's the most common symptom, that is the dry mouth. This happens because of the fact that the salivary flow kind of diminishes. The composition of saliva also changes as you approach menopause, and this is because of the fact that salivary receptors of estrogen kind of the circulating estrogen in the body it becomes less, and also it also can lead to the mucosa looking pale and grayish, and it looks drier, and it often bleeds easily for whatever reasons. Now when it comes to other things after xerostomia, there's something very important such as burning mouth syndrome. Burning mouth syndrome is of two types. The primary one has no ascribable cause. The secondary one also has some cause that you can ascribe to. But if you're having a primary burning mouth syndrome without any other cause, and you are postmenopausal, there's a high likely chance that has to do something with your burning mouth syndrome, where you get burning sensation and you cannot enjoy spicy foods, and sometimes you just get burning sensation without having anything ingested. So coming to the next thing, because of the fact that you have dry mouth, you can also have an increased propensity towards dental caries, gingivitis and periodontitis. Now you have to understand that the bone metabolism is kind of controlled by progesterone, and the soft tissue epithelium integrity is kind of affected by how much estrogen is circulating in your body. Now these both hormones, they decline in the level, because of which what happens that your epithelium, that is your skin, basically the top layer of your skin or your oral mucosa, it becomes atrophic. That means the cells undergo atrophy. That means they diminish in size and they undergo thin, right? So there's thinning of the epithelium, so it is more susceptible to injury, it is more susceptible to infection, it is more susceptible to other symptoms. Now when it comes to your bone metabolism, you have to understand that a lot of women, mostly all of the women, they undergo osteoporosis because of the fact that the level of calcium and the bone mineral density goes down, because of the decline in the circulating progesterone levels with diminishing calcium levels as well. So you have to understand that your bone metabolism is kind of affected, which has been found in studies that you are more likely to have diseases like periodontitis. You're most likely to have tooth loss more than compared to premenopausal women. That's something very important. And it is more important to understand you can have more propensity towards gingivitis and periodontitis, because your circulating sex hormones also play a role in your metabolism and your immunity. So for the same amount of plaque and bacteria and microbial biofilms and all those microbial attacks that's there in the plaque, your immunity is reduced after menopause, and that's why you can have more of problems such as gingivitis and periodontitis. It's absolutely important. And finally, you have to understand that there could be mood changes in your body, because of the fact that these also govern the psychosomatic part of your body, about how your mood is governed. Your depression can increase, depressive episodes can increase, anxiety can increase. It can also lead to neurological disorders such as trigeminal neuralgia, which is a very harrowing experience where you get an electric shock like symptom in your face, which gets triggered by something. It could be just cold water splash, it could be just and it goes on for months, and its treatment is very chronic that way. And finally, you could have mood disorders, because of which you can go for eating disorders. You can have bulimia, you can have anorexia and all those things, where because of the fact that you do not have that kind of similar taste perception as before, you might end up having more sugary substances, and that can lead you to be more susceptible to diabetes mellitus, and you have to be very careful. Now, what is the treatment about it? Of course, now menopause is an actual natural phenomenon, that is something like a mandate. There's never been a case that you never undergo menopause. So once you are going through it, what is your responsibility? It's very simple. Keep your oral hygiene in check, keep your oral health in check, make sure you're visiting your dentist very regularly, and also if there is a need for hormone replacement therapy because if your symptoms are overwhelming, please make sure you visit your gynecologist and consider the applicability of the feasibility of going for a hormone replacement therapy. However, the discretion of the dose, the mode of administration, the duration, everything else would be decided by the the gynecologist or your endocrinologist. So that is something that is very important. That's their discretion, not the dentist discretion. But if you go to the dentist and the dentist notice some changes in your mouth, which might be very suggestive that these are very much related to menopause, and the dentist refers you to a gynecologist or an endocrinologist, you might as well go to them and get yourself checked out. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, your location, and the common oral health problem that's causing you discomfort. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.